health news now. An allergy may seem simple most of the time, it's easily remedied by an antihistamine, but if it is not addressed soon enough, it can lead to anaphylaxis, a serious allergic reaction that can turn serious or even fatal. Now, here to take us through the condition and how to prevent the worst allergic reactions is Dr. Christine Gutierrez, head of the Allergy and Clinical Immunology section of the World City Medical Center. Good morning to you, Dr. Gutierrez.
Hello, good morning.
Now, there's a whole lot of medical terms that whenever, we kind of hear those terms for anaphylaxis or common allergy. Explain to us very easily and very briefly. Anaphylaxis is a long word for?
A severe form of allergy wherein you can have difficulty of breathing or even death after a while. So, well, first of all, we know that allergy is actually something that's hereditary. And then when it's not controlled, then sometimes it can lead actually to anaphylaxis or severe form of allergy.
Okay, so we're not talking about the kind of allergies that you kind of wake up in the morning and get sniffles, or you hear.
Your sniffles is actually another form of allergy, but for anaphylaxis, it is actually wherein you have difficulty of breathing, sometimes headache, sometimes lightheadedness, or abdominal pain. But usually the first manifestation of allergy would actually be skin rashes. When you have hives all over your body, and sometimes you have angioedema or swelling of your mouth, or your ears sometimes, and after a while you'd have difficulty of breathing. So actually it's one of the more severe forms of allergy.
Okay, you mentioned it is hereditary.
Yes.
Some people can just have it already in their immune system. But what are other causes of anaphylaxis?
Well, the most common cause would still be food, actually. And still here in the Philippines, it's seafood, followed by fish, sometimes peanuts, or let's say cow's milk, or even wheat or eggs. Sometimes it can cause anaphylaxis. And next would actually be drugs. Sometimes IV drugs or oral drugs can cause all of these, or stings, bee stings, or even let's say ant stings can sometimes cause anaphylaxis. Okay,
so once you've been exposed to something that you're allergic of and you notice there are certain skin rashes or it comes out in a certain way, but then it kind of goes away.
Yes.
What are you supposed to do?
It's not actually an anaphylaxis if that's the case. Sometimes anaphylaxis, once you're exposed, after 15 minutes to about 2 hours, you'll develop the signs and symptoms.
I see.
So that's actually one of the things which I see
so
a lot
from the very get-go. It's a little it's a little scary. I always ask some friends who are allergic to seafood. I'm like, how did you find out that you were allergic? Oh, well, I had it once and then I couldn't breathe.
Oh, yes.
And so it's a little scary because you don't necessarily know what you're allergic to or what the cause of your anaphylaxis is until you actually go through almost something that could be fatal.
That's true. That's the number one treatment to any allergy is number one, you have to actually know what you're allergic to and avoid it. Some of my patients have actually anaphylaxis. They ask me, Doctor, can I just take the antihistamine first and then eat the food? I would always tell them, of course not, because the number one treatment, avoid. And if, let's say, you are accidentally exposed to that, you have to bring your epinephrine with you. It's actually an epi kit. Unfortunately, here in the Philippines, we don't have the EpiPen. I know in the States you've heard of that, the EpiPen, or if you've watched certain movies, they put something in their thigh. But here we don't have that. But in our society, in the Philippine Allergy of Asthma and Immunology, we actually have the Epi kit, as we call it. You just have to break it open and put the epinephrine with you.
Okay, I have a couple of friends who are allergic to seafood, and I've this one friend who kind of just smells it, and she starts to already react. Her body starts getting itchy, and then in a couple of minutes she feels like she can't breathe. There was one time when we're all out to dinner, she didn't realize that there was a little bit of seafood in one of the foods, and then she took sugar. Is that something?
No,
that's not.
That's not true.
Okay. I don't know how that happened, but are there any, what my question was leading to, are there any other remedies outside of, the EpiPen that we were just
Number one is avoidance. No matter what we do, it's actually avoidance.
Don't play with fire.
No, not even. I also have a lot of patients wherein they try to eat it little by little, and I tell them no, because in true allergy, if it's real allergy, even just a few or a small amount would actually lead to your anaphylaxis.
Oh, I see. Okay. So, again, avoidance, anything?
Avoidance, then you have to actually know what you're allergic to. And then number 3 would actually to bring your EpiPen with you and at least identify that you really have an allergy to that.
Now, if you don't have an EpiPen, say, for example, you left it in the car or something and it's kind of an emergency, you're at a restaurant, something, is there something that you can ask for? I mean, are you just supposed to, you know...
You have to go to the hospital.
You
That's why, unfortunately, EpiPen would actually be very, very life-saving. That's why education is very important.
Don't take it lightly.
Don't take it lightly.
They can be...
Some would actually, it's just a rash, and then they feel a lump in their throat, and in a matter of a few minutes, you could actually die from it.
Wow. Now, how many people what percentage of the population has anaphylaxis?
Unfortunately, it's underreported. Because sometimes they just feel it's just a mild form of allergy, but it can be an anaphylaxis. Sometimes the manifestation could be abdominal pain. After they eat certain things, you can have crampy abdominal pain, followed by vomiting or diarrhea. It can be a form of allergy. But in terms of incidence, it's around 5 to every 100,000 that can cause anaphylaxis. And with proper education, hopefully we can...
So if you don't know you have anaphylaxis yet, but you are little by little ingesting the food, there could, or food or whatever it is that you are actually allergic to, one day it can kind of just sneak up on you. And I mean, there are plenty of times that I feel like, oh, I had a little bit of something. Oh, this is the negative effect. Oh, but I got over it, so it's fine. But really, you know, the smart thing to do is not what I do, and it's to actually go see a doctor. Correct?
And you have to be very, very sure that you actually have anaphylaxis.
Now, I mean, we're seeing, what are some symptoms of anaphylaxis? Go ahead and go.
It's actually a systemic disease. So, first of all, it can be the most common would actually be skin manifestations, followed by respiratory manifestations, and then sometimes gastrointestinal, like you vomit, or sometimes you have diarrhea, but itching is actually the number 1.
Itching is number 1. Okay.
And then you have redness or hives all over your body, then that's the start of it.
Now, is there a particular age that people are more susceptible to getting anaphylaxis?
Unfortunately,
or for parents out there who are kind of, you know, worried, especially when school comes around and people get their, you know, are exposed to many things. Their children are exposed to many things.
Unfortunately, there's actually no real age wherein it's most common. Sometimes it can happen in childhood, or sometimes even if you're an adult.
Okay, any vaccines, anything that you can do early on to...
None, actually. None. So actually, number 1 would actually be know what you're allergic to. We can do this by 2 methods. One is the skin prick test, wherein certified allergists would do it. And second would be through a blood test to identify specifically what you're allergic to.
The skin prick test is the one where you just get a bunch of needles.
Scratch, actually, just like a prick. It's not exactly...
That's not what I heard, doctor. That's not what I heard. No, but I mean, it is very useful information, especially if, you know, it is something that can become fatal. Now, if people do want to learn more about anaphylaxis or about allergies in general, tell us about where they can go.
We actually have this July 3 National Allergy Day. It's actually free admission. It's going to be in ang bahay ng alumni in UP. It's free, open to all, wherein you're going to learn about all the forms of allergy, starting from allergic rhinitis down to anaphylaxis. And hopefully you could join us there, or those people who would like to know more about allergies.
And don't underestimate your allergies. I know sometimes people can kind of just brush it off to the side. But we don't want to see these. We don't want to see any fatalities from it, especially when it can be avoided if you know. Knowledge is power.
Yes,
knowledge power. All right, and Doc, outside of July 3, where can any patients or people who are interested in getting in contact with you find you?
Okay, I actually have my cell number. It's 0921-461-8636. And you could actually go through our website also in the PSAI, psai.org, psaai.org, and they could Google on if they want to know more about their allergies.
Okay, all right. Well, thank you so much, Doctor. Oh, my very last question.
Yes.
Is there a season where allergies are kind of brought, of course, we always say like the beginning of, in the States, at least spring, where things are blossoming. Anything around for us here in the Philippines?
For anaphylaxis, there's actually no season, no predilection, but let's say for allergic rhinitis and all the other forms of asthma, usually if there's a sudden change in temperature, then yes, you can actually increase the incidence of allergies.
All right, well, that's been up and down lately.
Oh, yes.
So people
especially now, after the storm or before the storm, a lot of allergies.
Well, July 3, learn more about your allergies. Thank you so much,
Okay,
Dr.
thank you very much. Okay.